Hey everybody, and welcome back to another episode of Design to Move. My name is Ryan Maxwell. Today we're going to go over your Erector Spinae muscles. Every week we bring you a new topic on a muscle distortion syndrome or movement imbalance. We try to give you a video tutorial on how to correct for it. We also accompany it with a blog series that we post down in the description below. So if you like what you're hearing, make sure to read up on the topic and subscribe to our channel. So let's get right into our topic on the Erector Spinae. Oftentimes we sit for an extended period, due to which the muscles that connect our femurs to our pelvis and our spine, they oftentimes get tight and shortened, due to which it pulls our pelvis down anteriorly, creating compressive forces on the back of the spine, lengthening the abdominal wall, which we're going to represent here as a rubber band, and creating hyperextension and inflation in the rib cage. The muscles that support the spine on the back side of the body oftentimes have a tendency to become tightened and shortened, creating pressure on the vertebrae and into the rib cage. So that's why today we want to show you how to use a foam roller to lengthen and inhibit the muscles on the back side of the spine, the extensors. Then learn how to activate the muscles on the opposite side to control the rotation of the pelvis. Then put it into an integrated position by learning how to contract your hamstrings and your abdominals. Both are responsible for maintaining that pelvic tilt. And then finally strengthen the abdominals in isolation by doing a simple crunch movement. Let's get right to it. So the Erector Spinae start at your sacrum, or the lower portion of your spine, right down by your tailbone, and then they come up and they basically cascade along the sides of the spine all the way up to the base of your neck. Let's get on the ground, and we're going to use a foam roller that's going to be perpendicular to your spine, and we're going to start down lower by the pelvis. Let's get down there. Okay, so let's head down to the ground. You're going to sit on your butt with your heels found right down on the floor. Place the roller right along the ridge of your pelvis, right where your spine meets up with the pelvis. Now what I'm going to do is I'm going to tilt my tailbone under just slightly by engaging my core, and that'll just naturally start to lengthen through those extensor groups. Now remember, your erectors fall on both sides of the spine, so if I want to isolate one over the other, I'm going to tilt my body slightly to one side. As I get into that position, I'm going to start rolling down the length of my spine until I come to a tender spot. Once I get there, I'm going to hold it there for about 30 to 60 seconds. After I've held it there for 30 seconds, I'm going to start a breathing pattern that's going to help to stretch the muscle under the pressure of the roller. I'm going to breathe in for 2 through my nose, making a point to try to expand through my rib cage, and then breathe out through my mouth. It would look something like this. So the act of breathing is used to expand the rib cage to pull through the length of the muscles as they're being pressed down on by the roller. And that's going to serve to floss that muscle beneath the pressure between the actual column and rib cage and the pressure of the roller. So as I breathe in, I'm stretching the muscle under the pressure, and as I breathe out, I release it. Every time I breathe, I'm hoping to get a little more contraction of my abdominals and help to use these muscles to lengthen the extensors on the back of the body. Since we're all one side dominant, we probably will notice that there's going to be more pressure on one side of the spine than the other. But for today's purposes, we're going to want to target both. Now remember, you're going to hold the pressure on those trigger points or those sensitive spots for about 30 to 60 seconds, and then go through that breathing cycle. Remember, you're breathing in through the nose for 2 and out through the mouth for 4 for about 4 to 6 repetitions. Once you've done both sides of the body, we'll move on to the next segment and target the midsection. Okay, so now we're going to stretch the extensors, and you got to recognize once again that these muscles are responsible for bringing the body upright, and they resist against gravity. So in order to stretch them, we're going to want to do the opposite of what the muscle action is. We want to tilt the pelvis under, tuck the chin down, and reach through the arms to create a concave curvature of the spine, and then breathe in at the same time. So it all together is going to look like this. So by tilting the tailbone under and tucking the chin under, you're actually elongating the Erector Spinae And then adding the breathing by breathing in is going to help to extend and lengthen the muscles at the same time. So all together, you concave the body, reach far, far, far away, tuck the chin, breathe in, breathe out, and come back to upright. Using your breathing actually teaches the nervous system to release the chronic tension in the Erector Spinae group. You can do the breathing pattern for about 6 to 8 repetitions, take a little break, and then go into it for a second time. As you come up out of the hips from that extended or flexed position, you're going to want to make sure that you breathe out and tuck your tailbone under, getting more of an abdominal contraction. And that will set us up for the next position as we activate. Let's get down there. So in the beginning of the video, we talked about how the pelvis turns under, and because of which it lengthens the abdominals and puts more pressure into the lower back. Because of which we have a tendency to flare through the rib cage, and that changes our respiratory patterns and how we breathe and are able to maintain our core strength. So for our next exercise, we're going to learn how to contract our abdominals, create more abdominal pressure, and still learn how to breathe despite that pressure. Let's get down on the ground. Okay, so everybody lay down on the ground on their backs. You're going to find your heels on the ground and then find your lower back into the mat. First step in this whole process is to take all the air out of your lungs, so you're going to actively breathe out, which actually engages your abdominals. So breathe out deep through your mouth until you feel your lower back on the ground and your ribs depress. While maintaining those ribs in a medially rotated depressed position, you're going to begin to breathe in through your nose once again for a count of 2, and then out through your mouth for a count of 4. As you breathe in, try your best not to let your ribs come off or your abdominal pressure to release, and make sure to keep your lower back on the ground. The important element of this exercise is the ability to contract the abdominals, and while in that contracted state, allow our diaphragm to breathe in and out so that our thoracic cavity can actually expand through the back of our ribs without having to hyperinflate and release our abdominals like so. So make sure once again to get all the air out, contract your abdominals down, find your lower back on the mat, and as you're in that position, breathe in as much as you can through your nose without letting the tension go for a count of 2, and then breathe out for a count of 4, creating a stronger contraction at the bottom. The ability to maintain your abdominal pressure is called intra-abdominal pressure. When you do that, that's actually going to push out on both the diaphragm and the pelvic floor. The goal here is to learn how to co-contract both of those mechanisms so you have appropriate lumbopelvic hip stability. So we targeted that in this position. Make sure to go through about 6 to 10 breathing patterns where you're trying your best to maintain that abdominal pressure. Take about 45-second to a minute break and then do it again. And then we'll go into our next movement that's going to engage the hamstrings along with it. Let's get started. So in the beginning of the video, we talked about how your body needs to be able to posteriorly tilt the pelvis under. The muscles responsible for doing this are the abdominals, but also the hamstrings. In our last segment, we talked about engaging your abdominals despite the thoracic pressure from breathing. So now we want to show you how to engage the hamstrings and abdominals together to maintain that position in the pelvis and the lower back. We'll need to get down on the ground to do it. Let's get down there. Okay, so once again, let's go down onto the ground. We're going to get into the same position that we were in for that activation. Your heels are going to be planted on the floor. And the first thing to do is once again get set up in the same position that we initiated. Tuck your chin under, pull your shoulder blades down and back, find your heels, and then push your lower back into the ground by getting all the air out of your chest wall. So breathe it all out. By doing that, you'll engage your abdominals. Now with this position set, we're going to breathe in through our nose, and at the same time, I'm going to push through my heels, breathing in and pushing through the heels, elevating the hips into extension, and then breathing out, slowly bringing the hips back down to the ground. Now if you notice, I'm not letting my hips completely touch the ground, and I'm driving my heels into the ground with my toes up and flexed towards my shin. So once again, I'm going to breathe in through the nose for 2, pushing the hips up, breathing out to a count of 4. If you notice, my hips are never going into extension, or rather my lower back is never going into extension. So I'm not going to push so high up that my lower back starts to arch. By maintaining the abdominal pressure and contracting my hamstrings and glutes together, this is going to teach my body how to keep that position all the time, so hopefully I can engage these same systems in an upright position. In the beginning, you might realize how hard it is to maintain that intra-abdominal pressure while breathing and using your glutes to lift the hips. Why? Because we sit a lot, our hip flexors are tight, we have other muscle groups that are feeding information to the brain to tell those other muscles that we're trying to target to turn off. So it's an important first step to learn how to do it in isolation while we're laying down on the ground. Learning how to maintain intra-abdominal pressure while breathing is going to go a long way to teach our bodies how to maintain core strength and stability. We're going to want to apply that same type of breathing pattern in everyday functional movements like lunges or squats or deadlifts. Make sure to get about 15 reps in each set. Take a 45-second break and then do a second set before you move on to your final crunch position. Let's get to it. So now that we've actually released the tension in the back side of the body and gotten our muscles to fire up on the front side of our spine, we now want to capitalize on that newfound neural strength and really isolate through a strength position, that crunch position that's going to target our rectus abdominis. Once again, we're going to need to get down on the ground to do that. Make sure to plant your heels down on the floor. This time I want you to lace your fingertips right behind the ridge of your skull. Don't lace them, just have them fanned out so it's going to support your head on a basket in your fingertips. Tuck your chin down and keep your shoulder blades down and back. Keep your elbows drawn back as best you can. If you have tight pectoral girdles, you might feel that those elbows are going to flank up to the ceiling, but try your best to keep them back. From this position, we're going to get into that same abdominal pressure position by getting all the air out of the lungs and keep the ribs down and depressed. So breathe out first. You'll notice that your upper back is going to come up off the ground. Now that the abdominals are engaged, you're going to maintain that position. Start to breathe in and crunch forward by lifting your rib cage off the ground. Breathe in. Breathe out. You'll notice as I do this, I'm keeping my lower back on the mat the entire time, and I'm not using my arms or my neck to lift off the ground. So there's going to be no hyperextension in the neck, and I'm not adducting my arms into the center of the body to try to create momentum to get my body weight up off the ground. So once again, tuck the chin, pull the shoulder blades back, pull the elbows along the sides of the head, tuck the chin, breathe in, and then breathe out. And contract the abs as you come down. Notice my tempo is going to be about a 2 count up and 4 count down. Now as I come down, once again, I'm going to try to keep the abdominals contracted and really focus on maintaining that intra-abdominal pressure despite gravity. A couple important takeaways: make sure to brace the head and don't use neck extension or your arms like we talked about to create momentum. You're basically cheating. And it's actually going to distort the neck and lead to some pain and muscular distortion syndromes in the shoulders and the neck, so we want to avoid that. Second, we want to make sure that we're breathing in as we come up, because I'm going to engage my abdominal pressure and diaphragm as a co-contracture, which is going to teach them to be able to live in harmony together. And as I come down, I'm going to breathe out and maintain that contracted position. So if you're keeping pace with the breathing pattern, it's going to be 2 seconds up and 4 seconds down for a total of 6 seconds per repetition. I'd like you to maintain that time under tension per rep for 15 to 20 reps per set. There's going to be 2 sets with a 1-minute recovery. Now if you're new to this type of core training where you're engaging your breathing with the co-abdominal contraction, it might be pretty challenging. So a few things: make sure no momentum, don't swing or use your neck to complete the motion. And 2, don't speed up the time under tension so that you can get through it quicker. If you can't get all the reps in, that's okay. Take a break and work up to it. Over time, you'll notice that your core is going to get a lot stronger. You're going to feel a lot more stable on your feet, and your functional movements like lunges and running are going to feel a lot better. So stay after it. So in today's Design to Move series, we show you how to release the Erector Spinae muscles. They're partially responsible for contributing to an anterior tilt in the hips. Along with the hip flexors, they pull the pelvis down and compress the spine. This is going to lengthen the abdominals and make it very hard for us to control our spinal column and pelvis. That's why it's so important that we learn how to engage the abdominals with our respiratory systems so that we can have a nice, strong, and stable core. Remember, every week we bring you a new topic on another muscle distortion syndrome or some type of postural distortion, so make sure to subscribe to our channel. If you have any questions, reach out to us at admin@fluidhealthandfitness.com, and remember, read our blog on the topic in the description below. Your body's designed to move, so stay in motion. We'll see you next week for another topic. Stay at it, guys.